we'll start by talking about a recent paper that was published. So hopefully folks can see my screen. So again, a little bit of a repeat of what we did last week, looking at some bad news and then the good news about vaccines. So this was an article just published in JAMA. Interestingly, you can see there by the incoming, at least nominated director of the CDC, Dr. Walensky. And what this did is looked at excess mortality from March through July across the US, and particularly focusing on folks between the ages of 25 and 44. So young to middle-aged adults, and looking at the impact of the COVID-19 pandemic. And I think what's interesting to note is, first of all, during that period of time, when you compare how many deaths were recorded over the course of those 4 months or so, there were almost 12,000 excess deaths compared to what would have been expected. So an expected rate would have been around 64,000, and we ended up having about 76,000 nationwide. So that's an increase, a ratio of 1.2 roughly. And then they broke it down and looked by region. And region 2, which is New York area, Connecticut, New Jersey, you can see that there was a much greater difference, really a 50% increase in expected or measured versus expected deaths. And that peaked at a ratio of 2.3, so over twice as many deaths as expected in the month of April. And you can see that correlates pretty clearly with deaths from COVID and in the pandemic. So about 80% of those deaths were attributable to COVID. So that is documented, measured COVID deaths. And so what this shows is that in region 2, over the course of the early part of the pandemic, there was significant increase in deaths among that younger adult population, most of which were attributable to COVID, and it resulted in well over 2 times the number of deaths that we would normally expect in that population. And then that ratio decreases significantly down to 1.2 essentially in July. So peaks when the pandemic peaked in that area and then declines. Again, looking in region 6 and region 9. So region 6 is the area that includes Louisiana and Texas. The region 9 includes California, Arizona, New Mexico, and Nevada. So these were states that had surges later in the summer, really starting in June and July. So their deaths actually peaked in July and August. But you can see here is in July, that's when they had their greatest excess mortality, really roughly 1.5 of what they saw or what they would be expecting at baseline. And, again, about half of those, 40 to 50%, were attributable to COVID-19. And so what you can see is overall during that period of time, there were about 1 per 100,000 deaths for the total population, which is, I think, a remarkably high number when you think about it for that low risk population. And when you compare that death toll to what we saw at the peak of the opioid epidemic, at least the highest rates in 2018, you can see that we lost more young adults to COVID-19 between March and July than we did to opioids during that same period of time in 2018. And obviously the death toll from young adults, I think, has increased significantly over the later months of the summer, when again, many of those in that population were infected in the early and midsummer in June and July. And so those deaths were still accumulating in August and September. And now we're seeing an increased surge in cases in that age group as well. And so what this reveals is a much higher toll of death among those folks that we would consider low risk, in quotes, and just highlights the impact of the pandemic overall. So now to good news, and I think this is good following on the Pfizer vaccine data. We now have data that was presented to the FDA's advisory committee yesterday. And what you can see is very similar data in terms of efficacy and safety for the Moderna vaccine versus Pfizer. So Moderna vaccine data here, as you can see, overall efficacy data measured as the incidence of symptomatic COVID infection 14 days after the second dose or beyond. And you can see that among 14,000 vaccinees and 14,000 receivers of placebo, 11 cases of COVID-19 documented in people who got the vaccine versus 185 in people who got placebo. So that's a vaccine efficacy of 94%. Which is amazingly high. And similar to what we saw with the Pfizer vaccine, you can see that that efficacy is relatively preserved across all of the different demographics, including folks over the age of 65. And so that is remarkably good news. What we also see when you look at safety data is, again, similar data to what we saw with the Pfizer vaccine. So the Moderna vaccine has a relatively high rate of local reactions that are mild or moderate in 80 to 90% of people who get the injection, slightly more after the second dose. But again, very few of these were graded as grade 3, which are more serious, or grade 4, grade 3 being things that would essentially interrupt your ability to do any kind of daily activities. And you can see that that was under 10%. And that's mostly just muscle soreness and pain at the injection site. And similarly for systemic reactions, we can see after the second dose, about 80% of people got some systemic reaction. That's either fever, chills, muscle aches, joint aches. But again, very few of those had anything that would be, 15% had a grade 3, but less than 0.1%, which would be considered a serious general reaction. Again, very rare. And so those safety data are similar to what we saw with Pfizer and similar to what we see with a number of other vaccines, including the shingles vaccine, which this probably has the highest or the closest relationship to. A couple of other important points that came out of the data. Probably the most important here is the fact that of recipients of the vaccine, as you can see, 14 days after the second dose, there were 0 cases of severe infection recorded in that group versus 30 that were recorded in the placebo group. So that's essentially 100% efficacy against in preventing serious COVID infection. Similar to what we saw in the Pfizer vaccine, the Moderna vaccine appears to give high rates of protection and very robust immunity even after only the first dose. And so this Kaplan-Meier curve shows accumulation of cases after the first dose. So this is day 0 is the time of the first dose. And you can see, similar to Pfizer, once you get to about day 14, those curves diverge considerably. And essentially, after day 14, almost nobody in the vaccine group had a documented case of COVID versus the placebo group, where you see actually exponentially rising numbers of cases. So really good evidence that there's efficacy 14 days after the first dose. And finally, in a piece of data that was not included in the Pfizer study, the Moderna study actually did nasal swabs of recipients coming back on day 28 for their second dose of vaccine. So different from Pfizer, the Moderna vaccine is scheduled at 0 and 28 days, not 0 and 21. But when they swabbed folks returning at day 28, what they found is out of the 14,000 vaccine recipients, 14 had positive PCRs in the vaccine group versus in the placebo group, 38. And so that's actually a 3-fold reduction in asymptomatic shedding among those vaccine recipients. So this is the first piece of data we have to show that the vaccine appears to reduce asymptomatic shedding and thus the risk of transmission as well as symptomatic disease. So that's an important piece of information. Important to note that it did not 100% protect against asymptomatic shedding, right? So it does not appear to give 100% sterile immunity. So therefore, we will still recommend that folks wear face masks and follow all of the precautions that we recommend to reduce the odds of transmission. However, it's great news that the vaccine appears to significantly reduce the odds of transmitting based on this one piece of data. So we'll obviously know more as we gather more information. But again, with the Moderna vaccine, appears to be just as safe and just as effective as the Pfizer vaccine. And I think everybody should have pretty good confidence in taking that vaccine as well. So that's all I have. Thanks, Shelley. I'll turn it back to you.